Elbow tennis is an inflammation in the tendons, the bands of tough tissue connecting the muscles of your lower arm to the bone. Elbow tennis causes pain that exudes from the outside of the upper part of the forearm, beneath the area where the elbow bends. These tendons damage or tear when you accidentally collide your elbow or overuse your forearm in repetitive or strenuous activity. The symptoms of elbow tennis include a burning sensation, pain in the arm to the hand, and weakness in the forearm and elbow. Activities that make excess use of the elbow, such as extending the forearm to lift something, making a fist to grip an object, holding a tennis racket, opening a door, or straightening your wrist, may increase pressure on tendons. Athletes and sportsmen who participate in weightlifting, racquetball, tennis, and squash are more prone to tennis elbow. Seeking consultation or treatment from an orthopedic specialist for tennis elbow helps reduce inflammation and reinstate elbow function. Health experts perform scanning tests, massage, or muscle-stimulating techniques to improve muscle recovery. We will discuss some of these methods to treat elbow tennis. Number 1. Rest. Resting your arm and taking a break from strenuous movements is the best therapy to treat elbow tennis. Skip doing activities that may irritate the tendon and aggravate your elbow pain. Number 2. Activity modification. Avoid putting strain on your elbow or forearms to prevent further injury to the affected muscles and tendons. Using your arms to perform repetitive manual tasks, such as lifting, gripping a racket during a swing, carpentry, typing, or painting put too much strain on the tendons. It leads to microscopic tears in the tissue. You may need to stop or change activities that may irritate the tendon until the pain in your arm improves. Number 3. Ice pack. Using an ice pack on the elbow helps ease pain and swelling. Experts recommend icing the injured area for 15 to 20 minutes every 3 to 4 hours. Cover ice with a thin cotton cloth or towel before applying it to your skin. Number 4. Heat therapy. Heat therapy may relieve pain only after the inflammation and swelling are diminished. Heat promotes blood flow, relaxes muscles, and progresses the healing of the tendon. Using a dry hot pad or heat pack helps heat penetrate deep into the tissues and promotes healing. Therapists suggest heat therapy after 48 hours of injury and not immediately at the onset. Number 5. Using splint or elbow splint. Wear a special counterforce brace to avoid pressure on the injured tendons. An elbow strap helps restrict your forearm movement and protects the injured tendon from further strain. Number 6. Topical nitric oxide. A study claimed that nitric oxide improves blood flow and tendon healing. In an experiment, topical nitric oxide patches were used to speed the recovery from an elbow injury. The clinical trials reveal positive results in the treatment of chronic tennis elbow. Number 7. Physical therapy. Undertaking physical therapy will do the trick in treating tennis elbow. The GP may refer you to a physiotherapist if the tennis elbow is causing severe or persistent pain. Healthcare professionals employ various methods to restore movement to injured areas of the body. Number 8. Strengthening exercises. The therapist uses manual therapy techniques of manipulation and massage to keep your arm mobile and strengthen your forearm muscles. They may suggest specific exercises for strengthening the forearm muscles. These exercises enhance blood flow to your arm, which reduces tension, relax muscles, and relieve pain. Number 9. Stretch the muscles. Stretching exercises and warm-up activities are essential before any physical activity that involves the affected elbow. Wrist extensors and wrist flexors are groups of muscles that should be strengthened for tennis elbow. Overuse of the tendons that join the forearm to the outside of the elbow may cause inflammation and pain. Doing stretching exercises for tennis elbow helps support forearm muscles and improve their function. Number 10. Performing range of motion exercises. Usually, tennis elbow restrains your elbow or arm movements. The physiotherapist recommends you perform a range of motion exercises several times a day to reduce stiffness and improve flexibility.